You know, if you deal with a lot of stiff neck problems, you know, neck pain or whatever, there could be some underlying issues that could really cause you problems bigger way down the road. So what you need to do is come see Dr. Sonia Spencer here on Pass Road in Gulfport at Spencer Chiropractic across from Pass Road Elementary and find out what kind of issues you have and, of course, what she can do to help you out. How are you? It's always a pleasure to see you.
It's great to see you. And you mentioned that neck stiffness, so I'm going to get right into talking about the #1 cause, which is arthritis.
Really?
Yes.
You know, you think of arthritis, you think of it like in your hands or something like that.
Well, it happens in the spine too. And there's a lot of different names for it, so people kind of get a little confused. Degenerative joint disease, degenerative disc disease, osteoarthritis. So this is a little model of the osteoarthritis, okay? So these are 2 bones and a very healthy disc. And this is phase 1 degeneration, where the disc gets a little bit thinner here. And in phase 2, you see where it's starting to get these little bone spurs here?
Yeah.
And the disc gets a lot thinner. You see this little thing poking out the side right there, Jim?
Yeah, the little yellow thing?
No,
this here.
Yeah.
Oh, that's a bulging disc.
That's a bulging disc.
Okay.
That's right, because when the joint gets a lot stiffer like that due to the arthritis, it's a lot easier for the disc to bulge. Because when you start to lose some of that water content in the disc is mostly water and protein. So when you start to lose the water in the disc, it can herniate a lot easier. That can put a lot of pressure on the nerves and really cause some excruciating pain. But we can help with this. And then all the way into phase 3, which you never want to go into phase 3, but I see this every single day, where it's a permanent loss of motion and the nerve literally just begins to die, okay? So this person has literally no motion in these 2 segments in their neck. Now, how many bones do you think you have in your neck, Jim?
32.
7. You have 7 bones in your neck. And if 2 or 4 of them have this joint disease, you know, over 50% of them have this, then you're losing quite a bit of motion in your neck. So it's really easy to kind of, you know, test yourself, and most patients do before they even get here. They go like this, and they go,
I know, I'm sitting here doing that myself.
My neck is stiff when I turn it, you know, and when I'm driving, it's, you know, it really stiffens up, and then, you know, when I lay down at night, it's hard to get a good night's sleep because it's so stiff, and, you know, it just starts affecting things that they do.
And what's scary, Doc, is looking at this, the difference between this here and the difference between this over here. It's scary.
It's very scary.
I mean, he's got bone protruding and sharp edges and everything that's going to really cause some problems.
Yes, and this is preventable in most cases. So, you know, most of the 20-year-olds I see are, you know, right here, and you can keep a healthy spine just like you can keep healthy teeth, you know, just by getting under regular chiropractic care and making sure your joints maintain good motion. And if you're injured, making sure that you have the proper treatment for that injury through proper chiropractic care. But once you get that stiff neck, say you're between phase 1 and phase 2, it's really important to break that cycle and get the joint moving again so that it doesn't continue to progress. So people say, oh, I have arthritis. You can't do anything about that. Well, we can't take the bone spurs away, but we can certainly stop the progression and reduce the symptoms, which is what you really want to do, you know? Just like if you're diagnosed with gum disease, once you have gum disease, you always have it, but you still need to keep treating it, or eventually you're going to lose your teeth. It's the same. Chiropractic and dentistry have very similar analogies, yeah, along those lines, because a lot could be done to prevent deterioration and poor health, and same thing, you know, with your mouth and so forth. So the better you take care of your spine, the more your nerve system can flow through these areas very quickly. Now let's talk about what would happen if you do pinch a nerve in your neck.
Okay.
You ever heard about a pinched nerve in your neck? Okay. So let's talk about that for a second. Well, this is something I see commonly too, is that a person will have a pinched nerve in their neck. So you have these lower segments in your neck that come down. They cause pain to come out into the shoulder, and then it can go all the way down into your arms and hands. Certain nerves go in one side of your hand, and certain nerves go into the other side of your hand. So wherever your arm is hurting really is a telltale sign for me that where some of the problem may be coming from. And we do certain tests on here to see, do you have numbness? Do you have tingling? Do you have pain? Is it sharp? Does it tingle? Is it positional? So we see this very commonly here in the chiropractic office. And there's lots of ways that we can treat this. We have traditional chiropractic care. We have decompression therapy, which is with non-surgical, drug-free decompression to heal up these herniated discs for patients who don't want to have surgery, who want to do this. We've had so many people come in. I've been recommended surgery on my neck, and you know, I saw this online and I want to do this first. And they're so glad that they did because it saved them from a surgery.
Yeah.
You know, especially people that sit at their desk all day in a certain position and they're intense with their work. You know, they can.
Plus, it takes you a lot longer time to recover from surgery than it does from, you know, getting an adjustment from you. I mean, get an adjustment from you, you go back after lunch.
Well, say you have a disc herniation and you want to take part in our decompression therapy. You know, that's 3 times a week. You know, for 30 minutes, as opposed to missing 6 to 8 weeks of work.
Because of surgery.
Yeah, and it's non-invasive, drug-free, and no drugs, no screws in your spine. You know, no cutting, none of that, and the patient left here pain-free. You know, and back at work. And
That's
really
great.
happy. So I could tell you a million stories like that. But you know, if you've been recommended surgery, you know, there are other things in our office that can help keep you out of surgery if that's what you want. Some people only want what their insurance will pay for. You know, this particular procedure is not covered, but it's still very affordable. You know, if you think of the time you're going to be off work and, you know, what it does to your body to have surgery and things like that. You know, there are other options. So.
But again, if you have the opportunity to go with something non-invasive like chiropractic care, definitely want to do that. I mean, that'd be, I mean, that's a no-brainer.
It's a no-brainer.
It really is.
So we have chiropractic, decompression, we have our class 4 laser, we have the piezo wave. We have lots of ways we can help patients who have neck pain, who have arthritis, who have disc herniations. You know, we're here to help.
That's all right. Dr. Spencer, it's a pleasure.
I almost bumped you.
Hey, we can bump. We can bump. If you're having neck pain or neck issues, shoulder issues, or anything like that, the stiffness and numbness going down your neck, you want to get some relief from it finally, make an appointment with Dr. Spencer, located here on Pass Road in Gulfport, right across from Pass Road Elementary.